My name is Runz. I'm a urologic surgeon at University of Maryland Shore Regional Health. I have been here in Easton going into my 20th year. I deal with all aspects of adult urology and urologic surgery, from cancer surgery to stone disease, sexual dysfunction issues. I have a particular interest in men's health. Men's health, however, is this catch-all term that underneath it has a million things in this bag, right? And what does it mean? And what's really interesting is we do have two other, as you're aware, months that are dedicated to men's issues, right? So, in September you have Prostate Cancer Awareness Month, right? Strictly prostate cancer awareness. And then you have November, which is Movember, and I'm sure maybe you guys do something on Movember, which is the men's mental health issues, right? But men's health in June, I think, it's a great opportunity to extend awareness to the population, not just men, but if you have a man in your life, a son, a husband, a spouse. And the idea here for men's health is recognizing sort of the top three things that really are low-hanging fruit that affect men's lives. And if you could create notes in your phone or write down a few bullet points on men's health, what does it really come down to? It comes down to me broadly. It is about blood vessel health. Right? Blood vessel health is critical for everything. We don't live without good blood supply, right? So access to care. Men are notoriously slow to get into primary care, to get screened. A lot of men don't start that until they're in their 30s or later. So, hey, you're in your 20s or your late 20s, you want to get plugged into a primary provider or primary physician for basic screening, right? Lipids, cholesterol, blood pressure. Are you insulin resistant? Diabetes, type 2 diabetes, is a major, major health problem in this country. Everybody knows that. We're making strides with medications, right? We all know these 3 new drugs that are on the market, right, for weight loss and diabetes. But why does it happen? How do you prevent that? Blood vessel health, access to primary care. And the other term that I like to talk about is metabolic syndrome. And in that, as far as urology, a piece of that puzzle is low testosterone. So I think if we can really identify those 3 things and get that to stick and resonate with people, please get a primary care physician. If you don't have one, get one. University of Maryland Shore Regional Health's primary care group is fantastic. They're in all 5 counties. You just need to call a number. So as far as blood vessel health issues, the number 1 cause of death for men, for you and I in this country, is heart attack or stroke. Number 1, and it's been that way for a while. Followed by cancer. Of those cancers, lung, prostate, colon are the big 3 killers. So access to care. Blood vessel health, heart attack and stroke occur because blood vessels, arteries in particular, they start to close down. That's an oversimplistic way of saying it, but atherosclerosis, arteriosclerosis, the arteries start to close. There are men in their teens and 20s that have abnormally high triglycerides and lipids, but they don't know that. There are men in their 20s and 30s that have normal cholesterol profiles, but have elevated Lp(a), which is a lipoprotein that isn't always checked in a standard lipid profile. But 1 in 5 men have elevated Lp(a) and don't know that. High blood pressure destroys blood vessels. So yes, cholesterol and triglycerides, but high blood pressure. We mentioned diabetes. Diabetes is a major problem in this country. And what does diabetes do? Elevated blood sugars, right? Increases fat body composition, fatty liver disease, and arteriosclerosis, atherosclerosis. So when blood vessels start to close, what do we notice as men? Like, what's the early warning indicator for us? It's erectile problems. right? So erectile dysfunction, it's a urology issue, but it's a major men's health problem. And it's the canary in the coal mine, that early warning indicator that my blood vessels may not be healthy. And not every patient with ED has a blood vessel health issue, but 50+% of them do. And it's early. So, we will see young guys in their 30s and 40s coming in with erectile dysfunction. Now, that could be psychogenic. It could be stress and anxiety related issues, as in some much younger guys. But you have to make sure that you're not missing something that's going to destroy blood vessels where 10, 15, 20 years down the road, they're dying of heart attacks and strokes, right? As American men, we still have that mentality or ideology that, we're the strong ones of the family, right? And we need to go out and we need to work, we need to provide for the family. I think that definitely has changed over the generations, no doubt. We see it with my parents and your parents, I'm sure, right? And my children, I have teenage girls. I see how much more aware they are of this kind of thing. And I think it is making it acceptable to go see a doctor as a man, especially a young male. Somehow getting that on the checklist. We all have to-do lists, right? We all have, our checklists for the day or for the year. It's got to get on that list at some point. Yeah, so metabolic syndrome, a syndrome is multiple disease states, okay? So metabolic syndrome is like you have these big puzzle pieces that you put together to build metabolic syndrome. So those puzzle pieces are high blood pressure, high cholesterol, high triglycerides, right? Insulin resistance, type 2 diabetes, right? Obesity. What do these things do is, very, very oversimplistically now, what they do is they increase body fat composition, decrease lean muscle mass, and the weight keeps piling on. You wind up with obstructive sleep apnea. You don't reach restful sleep. You're napping in the afternoon. The weight packs on. Type 2 diabetes, the weight packs on. And and men cannot get out of the weight of this cycle. And we see it every day. Every primary care provider sees this on a regular basis. Every endocrinologist sees it. Men's health clinics, we see it every single day. And in there is low testosterone. And testosterone is the male hormone made by the testicles. And it is very, very important. We need testosterone. Now, when you go back in the early part of the 2000s, upward to about 2000, even 11 and 12, there was still this concern that testosterone replacement had serious negative health impacts. There were risks involved with that. They have all, on a global level, been completely reversed. We were wrong thinking. And that started when you go back to the 1940s with two famous urologists that found that men who had prostate cancer, right, if you took away their testosterone, you shut down the cancer. And that's a fact. So they flipped that and took that inverse and said, well, testosterone must cause prostate cancer. And that's not at all the case. So testosterone got a bad rap early on. And testosterone replacement over the decades has come and gone. Hey, it's the right thing to do. Hey, it's the wrong thing to do. And we can tell you for an absolute fact that testosterone replacement for the vast majority of the men is net positive. And it does lower the risk of heart attack and stroke in the majority of low testosterone men. There is, I don't want to get too deep in the weeds on this because we're getting a little off topic, but on every testosterone product sold in the US, the FDA still for decades has a black box warning that says we do not know if testosterone replacement increases or decreases the risk of heart attack or stroke, where every major study globally shows that it lowers the risk. But that's still out there. So it's considered controversial, but in reality, it is not. So low testosterone in men under age 50, 35% of men have low testosterone. When you get above age 50, especially towards age 70, you're looking at almost 70, 75% of men have low testosterone. And here's the real linchpin. Here's the kicker, is 50% of men with type 2 diabetes have low testosterone. Now, low testosterone does not in itself cause type 2 diabetes, but there is an association there. And what we do notice is in especially younger men, when I mean younger men, 20s, 30s, 40s, 50s, 60s, those men, when they have type 2 diabetes and they have low testosterone, and you work them up, you figure out why they have low testosterone, and if they in fact do need testosterone replacement, when you get their testosterone back to normal, what you will find is that their diabetes control becomes better. And often they come off some of their diabetes medications. They come off some of their diabetes medications. And a number of men will come off all of them, strictly by getting their testosterone back to normal. Well, it's not just the testosterone, because what happens with testosterone, so the symptoms of low testosterone are energy levels go down, so fatigue. You kind of mentally feel down, like someone's pulling a shade down, and and it's dark. You're gloomy. You lose muscle mass slowly over time. You gain body fat. You lose bone density, so osteopenia and osteoporosis. So erectile dysfunction, libido dramatically goes down. I mean, libido is directly proportional to testosterone. So when you reverse that, right, lean muscle mass starts to come back. You lose body fat composition, right? So insulin resistance, which is, again, I don't want to get too deep in the weeds on this is metabolic stuff, but you are actually able to utilize glucose better to drive it into the muscle cells, right? You're not storing it as fat or fat in the liver, non-alcoholic fatty liver disease, and diabetes becomes better controlled and oftentimes off medications.